I attended the University of Southern California where I completed my dental school training, after which I was accepted into a residency program at the Ohio State Medical Center in Columbus, Ohio.
I'm a dental anesthesiologist. I went to dental school at UNLV in Las Vegas, and I did my anesthesia training at Stony Brook University Hospital in New York.
One of the benefits of being a dentist anesthesiologist is our training. We've actually done a lot of the procedures for which we're providing anesthesia, and I think that helps us better tailor our anesthesia for our patients. It also allows us to help the dental surgeon in ways that, you know, someone who hasn't had our training may not be able to do.
The typical patient for anesthesia would be one who has a severe fear or anxiety of the dentist or healthcare providers, patients who are unable to cooperate, patients who also need a significant amount of work to be done, as well as special needs patients.
One of the unique things about providing anesthesia for dental procedures is that the surgeon and the anesthesiologist share the airway. So that airway needs to be protected. And one of the ways that we do that is that we place what we call an endotracheal tube or a breathing tube. This tube, you know, is gently placed through the nose, back behind the tongue into that windpipe to keep that airway safe and secure.
Secure airway means ensuring that nothing gets down into the airway that shouldn't be there, such as blood, dental debris, water, saliva, or anything else. It also allows us to monitor the patient's breathing much easier than not having an airway adjunct placed.
At SedaDent, we've tried hard to invest into the latest technology. We now have video laryngoscopes that allow us to see actually in HD what's going on you know, behind the tongue. It allows us to place those breathing tubes very atraumatically and very easily.
We make sure that the equipment that we use meets and exceeds state regulations. We use the same type of equipment that would be used in a hospital. We monitor all the important vitals, as well as carry with us backup equipment and emergency medications.
Some of the comments that we generally receive from dentists are, wow, this was just like it was in the hospital, or this is just like the procedure that I did, you know, yesterday in the surgery center. And I think they're also surprised to find out how quickly they can do the procedure. They realize that, hey, I can work without interference from the tongue or without having to stop and have a conversation with the patient. So I think they find that their efficiency improves.